And good morning to you. It's February 5th, 2025. We're streaming live spine surgery from Deuk Spine Institute. Our patient has had a fusion done on her neck. She now has adjacent segment disease above the fusion. She has facet joint pain, and it hurts to rotate and extend her neck. That pain is coming from the facet joints that have arthritis in them. We're going to go in and fix that. So it's bilateral. We'll be doing bilateral Deuk plasma rhizotomy. Henry, let's show the audience the 30 different causes of neck pain.
Of course.
I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. You've been watching our video on the 30 causes of neck pain. You can see the facet joint is the second most common cause of neck pain, and that's what this patient has. So right now we are on the left side of her neck above her fusion. Can you see that x-ray, Henry?
Yes, we can.
All right, I've just finished doing the rhizotomy at C2. Show us C2, there you go. That's the lateral mass of C2. If you follow it medially, you can see the odontoid peg from the top. Go to the top, yeah, right there. So we know that's C2, and now I'm moving on to C3, which is the next lateral mass, and then C4, and I'll probably do C5 as well. And then we're going to go to the other side. So we're basically destroying the pain nerve to the joint. It's called the medial branch of the dorsal ramus. It is the best treatment in the world for this problem. There's nothing better. Let's show the audience how this treatment is done and why we do it.
Of course.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. So you see how we do it. We basically go into the target facets that are causing pain, and I use a probe called the Deuk plasma wand. I destroy the pain nerves by cutting them. That permanently destroys them. There is no other procedure in the world that does this. We're the first to do it, and we're the only ones doing it. Shot. We're going to move to the other side. Very good. I'll take the question.
This question is coming from Lanu on YouTube.
Oh, Lanu. Lanu, it's so good to have you. I mean, I love it. And thank you for being here. Thank you for asking questions. Thank you for making me making us feel loved and appreciated.
Of course. Lanu asking, I didn't know you do surgeries on Wednesday. I thought it used to be on Thursdays. Me and some of my medical friends considered Wednesday as a lucky day of the week. Thank you, Doc.
Oh, you're welcome. So, Lanu, I don't normally do surgery on Wednesday, but sometimes we have situations where the patients, where we can't do it on Tuesday and Thursday, and we have to do it Wednesday. So, I make an exception and I do the surgery Wednesday. Normally, I'm in clinic, and as a matter of fact, I was over in clinic seeing patients, and I just came over to do this one patient's surgery. But by the way, since you are here, Sean, the fusion from yesterday is doing fantastic. His piriformis pain is gone, Sean. And he is very happy. And the other patient's pain is gone, all of them. They're all very happy. Their pain is completely gone, 100%. They're all going home. They came in for a quick checkup. The patient from Miami, we did the 3-level cervical DLDR. Pain is completely gone. He just has some soreness from the Deuk plasma rhizotomy we did. Let's see. Shot? Yeah. And then we had the patient from Wisconsin who is doing fantastic. He's heading home. And then we had the patient from, another patient from Miami who's doing fantastic, heading home. And we had the lady from New Jersey. That's right, I keep forgetting where she's from. Zero pain today, very happy. She's heading home. So, very successful day yesterday in terms of pain relief. And hopefully this patient will have equally good results with her neck pain. We're done in 2 minutes. 1 minute. All right, any other questions or comments?
At this moment, no current questions or comments.
All right, we're just finishing up destroying the pain nerves on the right side of the neck with our plasma wand, and then we're going to be finished because we've already done the left side. Shot. This patient has bilateral facet pain, and it turns out that about 50% of the patients we treat with facet pain, they have unilateral one side. The other 50% have bilateral. And one thing that's important to keep in mind, when I get rid of the facet pain, the secondary problem they have is their muscles are usually atrophied. They have bad muscle atrophy. They haven't used their muscles properly in years because it hurts to move their neck. So they basically have poor range of motion. They have chronic cervical strain. And they need, fixing their facet pain is the first step to rehabilitating them. But they still need to have physical therapy, okay? And I don't send my patients out for physical therapy anymore. I used to. The problem is that the physical therapist a lot of times will cause some injuries to their spine by being too aggressive too soon, Unfortunately, a lot of the physical therapists, they don't know how to do therapy for Deuk laser disc repair, so they're just doing their usual therapy for other things that they treat, and they don't understand the restrictions. And I've had a few physical therapists go overboard and do too much. We're done. All right, so the Deuk plasma rhizotomy bilateral, C2 down to, I went down to C5 just to be sure that we got it all. She's snoozing. I'm just putting a little medicine to make it more comfortable so the burning doesn't hurt her so much. You could see on the x-ray she's had a fusion done. The incisions are tiny, 4 millimeters. And we're done for today. So this is my only surgery for today. Overflow from yesterday. I'll be back. I won't be operating tomorrow because I was supposed to be out of town for a meeting, but we'll be back on Tuesday next week, right? We have cases Tuesday. So please join us. Henry, will you add the cases from Tuesday onto the calendar?
Of course, not a problem.
Any other questions?
Yes, we have about 2 questions. This first one is coming from Ramazan on YouTube.
Hi, Ramazan. Welcome.
Asking, I got chronic neck pain. I saw a neurologist. I got headaches from my neck. Neurologist believes I got migraine problems. He offered Botox injections. Can I get benefits from Botox?
Yes. Yes, as a matter of fact, we do the same thing. We give Botox injections into the muscles of the neck, which is very effective at treating migraines that come from the muscles. However, I believe your pain is coming from something else other than the muscles. It's most likely coming from your facet joints or your disc. It's very rare that the muscle is the primary source. So they're not really fixing your problem, and you're going to have to keep coming back getting injections over and over and over again. My advice is do the free MRI review if you haven't done it with me and get a real diagnosis, and then come and get it fixed properly so it doesn't come back ever again.
And then lastly, coming from Marwan on YouTube.
Hello, Marwan.
Asking, is the Deuk plasma rhizotomy better than a radiofrequency ablation?
It sure is. The radiofrequency ablation is a technique that is old. It doesn't work well at all. And 50% of the patients, they don't get any relief. The other 50%, the relief they get is temporary, and it comes back usually in a few weeks or months. The reason is they're not cutting the pain nerve like I am. To cut the pain nerve, you need more energy, a stiffer wand, and you need to move it side to side to chop the pain nerve. They don't chop the pain nerve. Now, the problem is these doctors are happy to not cure your pain because they get more money every time you come back to have treatment. So they're not interested in giving you a permanent solution. We are at Deuk Spine. We pioneered the permanent solution. We're the first ones to do it. We're the only ones doing it. And if you want permanent pain relief, come to Deuk Spine. If you want to keep getting temporary relief that lasts a few weeks, then do an RFA. But the Deuk plasma rhizotomy is like the next evolution of radiofrequency ablation. It is the best treatment in the world for that problem, and it's a permanent treatment, so you never have to come back. All right, thanks, Henry.
Of course.
And maybe you can show the Deuk plasma rhizotomy animation one more time before we close up.
Of course.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK